Hi, morning. So today we have a very interesting case, and the patient is someone whom you all might know if you have come to Musk. Yes, he is Dr. Rahul Vyas. Yes, he is a clinical dermatologist at Musk. And hi, doc. How are you?
Good morning. I'm fine.
Good morning.
Yep.
And we are going to perform a hair restoration on him today. Yeah. Basically, in his case, what we are doing today is a revision hair restoration. Yes, he's undergone a hair restoration 6 years back. Yes, and today we are going to make it more denser and try to give him the maximum coverage he can. Yes, we're gonna come ahead with the hairline, but we just want to keep the same hairline and just increase the density right from the hairline towards the vertex. So there's a plan in this case. Now again, we have a restricted donor area in this case. Yes, so if you look at it, the donor come, we have a limited donor area to work with, a donor area which has been used before also, alright. So we are also going to make use of his beard, yes, right from out here. He's got a very strong beard, and I can remove a good 500 to 700 hair grafts just from the beard, yes. So if that can add up to the existing pool of grafts, it's going to look really good, right? So you are ready for it?
Yeah. Very ready.
It took around I think 4 years to, trust me, into doing a hair restoration on him. Am I right?
Yes, of course.
And now finally he thinks that I am worth doing a hair restoration.
No, not at all. It's not like that.
But yes, what is your expectation of the procedure?
Yeah, basically, so what I personally feel that it needs more a bit of density, and I'm okay with the hairline, but all I feel that there are some bald patches in between which I need to cover. And one thing is that I was not very regular in taking my medications, so that I am guilty as charged. So I have made a promise to Dr. Anand that I'll be doing a proper medication routine as well, so that I can get my...
The medication routine which he's talking about is to retain his existing hair, yes? Whatever existing hair he had when he underwent the first hair restoration, they have gone because he did not take care to retain them. Now doctors, as doctors, we like to advise, we give so many different advices to our patients, but then at times we forget to do the same, yes? So that is exactly what we are not going to do now, yes? And we are going to take care to retain the existing hair. Am I right?
Of course.
Yes? All set for it?
Of course.
Alright, let's do this.